keep getting better.
Good morning, everybody. Welcome to Fox vs. Myths, Empowering Women's Health, a mini-series advocacy. For today's episode, entitled Family Planning Must Knows, we will dealing with common FA myths and misconceptions. Our session is in an FAQ format. We will answer questions in the following topics: family planning in general, pills, injectables, condoms, IUD, ligation, vasectomy, NFP or FABM. Is family planning a form of abortion? The answer is no. Family planning is not abortion. Abortion is ending a pregnancy, while FP prevents pregnancy through the use of contraceptives. FP prevents induced abortion by helping couples avoid unplanned pregnancies. Are family planning methods harmful to health? The answer is no. All family planning methods are safe, effective, and reliable if properly used. Couples can choose the method that is best suited. We can call it young for them depending on their needs and health condition. Will using a contraceptive method increase or decrease sexual desire? The answer is no. Sexual desire varies from person to person. In general, use of contraceptives does not affect an individual's sexual desire. In fact, the use of contraceptive frees the couple from the fear of unplanned pregnancies. This enhances the couple's sexual relationship. Family planning methods are divided into two: modern FP and natural FP. In modern FP, there are two types: permanent method and supply method. In permanent method, that includes female sterilization or ligation and male sterilization or vasectomy. Supply methods are commodities given to the client. That includes pills, IUD, injectable, and male condom. Natural FP or fertility awareness-based method includes Billings ovulation or cervical mucus method, basal body temperature method, symptothermal method, standard days method, and lactation amenorrhea method. We will now answering question regarding pills. Will pills accumulate in the body and cause different health problems? The answer is no. After pills are swallowed, they dissolve in the digestive system just like any food or medicine. They do not accumulate anywhere in the body. After they produce their contraceptive effect, the hormones in the pills are metabolized in the liver and gut and are then eliminated in the body. Each pill lasts about 24 hours in the woman's body and does not get stuck anywhere. That is why pills are taken every day, preferably at the same time, to be effective. Is it true that pills cause cancer of the ovary and the lining of the uterus? The answer is no. Facts of ovarian and endometrial cancer. Pills protects its user from cancer of the ovaries and cancer of the lining of the uterus. This protection continues for 15 or more years after stopping the use of pills. Is it true that pills cause cancer of the breast? The answer is no. Facts of breast cancer. Research findings about pills and breast cancer are difficult to interpret. Both pills user and women who do not use pills can have breast cancer. In previous scientific studies, breast cancer was slightly more common among women using pills and those who had used it in the past 10 years than among other women. Prior to 1975, each pill tablet contained higher dose of estrogen that is associated with the increased risk of breast cancer among women with history in the family of breast cancer. these pills are no longer available today. Is it true that pills cause cancer of the cervix? The answer is no. Facts of cervical cancer. Cervical cancer is caused by human papillomavirus or HPV. It's a common STI. Major risk factors include multiple pregnancy, having first pregnancy at a young age, multiple sex partner, and smoking. Use of pills over 5 years appears to speed up the development of persistent existing HPV infection into cervical cancer. The number of cervical cancer cases associated with the pill use is thought to be very small, and the risk disappears after 10 years. Is it true that pills cause delay in conceiving or prevent women from being able to have children in the future? The answer is no. Pills do not cause infertility regardless of how long a woman has taken them. Women who stop using pills can become pregnant right away. It does not reduce your chances of becoming pregnant once you stop taking them. Is it true that pills can cause birth defects or abortion? The answer is no. Pills are taken to prevent conception, not to cause an abortion. Pills prevent ovulation, maturing and release of an egg, so that fertilization cannot occur. Therefore, if there is no fertilization or meeting of egg and sperm, there can be no pregnancy. Abortion cannot happen without pregnancy. If taken correctly, pills are very effective in preventing pregnancy. However, in the event of pregnancy, evidence shows that pills do not cause birth defects or abortion. Do pills encourage infidelity or promiscuity in women? The answer is no. There is no evidence that pills affect women's sexual behavior. In fact, using contraception shows responsible behavior to avoid unintended pregnancy. Do pills reduce sexual pleasure or interest in sex, or cause rigidity in women? The answer is no. There is no evidence that pills affects a woman's drive. Although some women use pills have reported either an increase or decrease in sexual interest and performance. It is difficult to say whether such changes are a result of the pills or other life events. Use of pills frees a couple from the fear of unplanned pregnancies, enhancing sexual relationships. Do pills cause women to gain or lose weight? The answer is no. Most women do not gain or lose weight as a result of pills use. A woman's weight may fluctuate naturally due to changes in age or life circumstances. Because changes in weight are common, many women attribute their natural weight gain or loss to the use of pills. Should I take the pill only on days that I have sex with my husband? The answer is no. You must take your pills every day in order not to become pregnant. Does the pill cause vaginal dryness, leading to painful sexual intercourse? The answer is no. There is no evidence showing that the pill causes vaginal dryness. We will now answering questions regarding injectables. Do injectable cause permanent infertility? The answer is no. Studies show that on the average women get pregnant is 9 to 10 months after their last injection of the MPA and 1 to 2 months or average of 5 months after their last injection of the combined injectable. Do injectable cause cancer? The answer is no. In fact, injectables protect against cancer of the lining of the uterus and cancer of the ovary. Findings between injectable use in breast cancer are similar to findings with pills. Both injectable users and women who do not use injectables can have breast cancer. Breast cancer were slightly more commonly using injectables or those who had used in the past 10 years than among the other women. It is unclear whether these findings are explained by earlier detection of existing breast cancer among injectable users or cancer were already existing before injectable use but were found sooner because they visit health facility more often. Do injectable cause abortion? The answer is no. Injectable prevents pregnancy. If there is no pregnancy, abortion cannot occur. Research show that it will never disrupt an existing pregnancy nor harm the baby. If I get pregnant while using injectables, will it harm my baby? The answer is no. Pregnancy during injectable use is very rare. In the rare event that a woman becomes pregnant while using injectables, there is no harm to the baby because the hormones in injectables are the same that women produce during pregnancy. Injectable are safe. Is my menstrual blood stored inside my uterus when I use injectables? No. Some women using injectable experience no monthly menstrual bleeding because there is no buildup in the endometrium, so there is no breakdown or resulting bleeding. Thus, blood are not stored in the uterus. Lack of menstruation has health benefits. It helps prevent anemia. Are injectables harmful to the breast milk or to the babies that are breastfed? The answer is no. There is no evidence that injectables negatively affect breast milk quality or production of the duration of lactation. Infants whose mothers have received injectables while breastfeeding develop similarly to infants of mothers who have not received the MPA. Now we will answering question regarding condom. Can the condom come off or break during sexual intercourse? Those who choose the condom should learn how to use it properly to minimize the possibility that it will break or slip off during sexual intercourse. Can male condom decreases man's libido and cause impotence? The answer is no. There is no evidence that condom use cause impotence. Many men, in fact, find that condoms help them keep an erection longer and reduce premature ejaculation. Some complain that it reduces sensation, but many couples learn to enjoy using condom. There are many types of condoms, and couple can choose a brand that will suit them best and give them the most pleasure. Are condom only used with prostitutes or for casual or extramarital sexual relationship? The answer is no. Condoms are an appropriate contraceptive method for anyone, regardless of marital status or sexual behavior. While many casual partners rely on condom for STI protection, married couples all over the world use condoms for pregnancy protection too. For example, in Japan, is it painful for a woman to have sexual intercourse with a man wearing a condom? The answer is no. Sexual intercourse may be painful for women who do not lubricate enough during lovemaking. Lubricate condoms are available for women who experience vaginal dryness during intercourse. If a condom slips off during sexual intercourse, is it possible for it to get lost inside the woman's body? The answer is no. Studies indicate that condom rarely slips off completely during intercourse. The slippage during withdrawal can be minimized if the rim of the condom is held against the base of the penis during withdrawal after ejaculation. However, if a condom does slip, it will go no farther than the woman's vagina, where it can be easily retrieved with no need for surgery. Are condoms effective in preventing pregnancy or sexually transmitted infection, including HIV? The answer is absolutely yes. Condoms are the only contraceptive method that can protect against both pregnancy and sexually transmitted infection, or STIs, including HIV. Latex condoms are made of fine material. No HIV can pass through it. In fact, when used consistently and correctly, condoms prevent up to 95% of HIV transmission. We are now answering questions regarding IUD. Does the IUD cause abortion? No. IUDs do not work by causing abortion. It works by preventing fertilization. The copper-bearing IUD acts as spermicide, killing or impairing sperm so they cannot reach the egg. Does the IUD cause cancer of the uterus? The answer is no. Studies shown that the IUD does not cause cancer of the uterus. If a woman becomes pregnant while using an IUD, Will this become implanted inside her baby's body or brain? The answer is no. The IUD cannot be implanted in a baby's body or brain. It does not cause malformation of the fetus. It is very rare for a woman using an IUD to become pregnant because the copper-bearing IUD act as a spermicide, killing or impairing sperm so they cannot reach the egg. If I use an IUD, will I still be able to have a baby? The answer is yes. Almost all women who use an IUD will be able to bear children once if it is removed. Does the IUD rot in the uterus after prolonged use? The answer is no. The IUD is made of inert material which does not rot in the uterus even with prolonged use. Can an IUD be pushed out of the uterus during sex and travel to other parts of a woman's body? The answer is no. The IUD stays within the uterus until it is removed by a trained health provider, just like a nut seed in a shell. There is no passage from the uterus where it can possibly travel to other organs of the body. If ever expelled, it would only come out from the vagina. Can the string of an IUD get entangled with a man's penis during sex? The answer is no. The strings of an IUD may get into contact with the penis during sexual intercourse, but the strings are very thin and soft, that the man will never feel it. Sometimes IUD strings are left long, and a man can feel them. Cutting the strings 1 to 2 centimeters will solve the problem. A man feel discomfort during sex if the IUD has started to come through the cervix. If a woman suspects this, she should see a doctor or a nurse. Is IUD harmful to health? The answer is no. It does not cause cancer. IUDs are safe. In fact, research suggests that non-hormonal IUDs, copper T38A, may protect against cancer of the lining of uterus and cervical cancer. It does not increase risk for STIs, including HIV. However, usually women who have high risk of exposure to gonorrhea or chlamydia should not have an IUD inserted. Can IUD cause infertility? The answer is no. Study finds no increased risk of infertility among women who have used IUDs, including young women and women with no children. Untreated pelvic inflammatory diseases caused by STIs are known and proven cause of infertility. After removal of IUD, there is no delay in a woman's return to fertility. We are now answering questions regarding tubal ligation. Does it involve removal of some or all parts of the woman's reproductive organs? The answer is no. Only the fallopian tubes are blocked or cut. All genital organs, including ovaries, uterus, cervix, and vagina, remain well functioning and women still have monthly menstruation. Sexual relationship is not affected. Does it cause illnesses due to hormonal imbalance? The answer is no. There are no side effects. The procedure does not cause ill health, backache, weakness, or other illness. Female hormones that are not affected and there will be neither loss of femininity nor any change in sexual functioning. Is ligation a painful and complicated procedure? The answer is no. New techniques have been developed using local anesthesia which make ligation possible without a hospital stay. Discomfort felt after the procedure can almost always be relieved with basic medication like paracetamol, ibuprofen, and mefenamic acid. After ligation, will I become sick and be unable to work? The answer is no. After ligation, you can resume regular activities as soon as you are free from post-procedure discomfort. Usually, doctors advise the woman to take 2 to 3 days rest and avoiding lifting of heavy objects for a week. Does ligation shorten the lifespan of a woman? The answer is no. Ligation has been practiced for several generations, and there is no medical evidence that ligation shortens the life of a woman. Does ligation cause irregular menstruation and early menopause? The answer is no. Research finds no major changes in bleeding patterns after female sterilization. If a woman was using another epi method before sterilization, her bleeding pattern will return to the way it was before she used it. Ligation will not hasten menopause. The woman will continue to ovulate and menstruate although she can no longer get pregnant. However, in general, a woman's monthly bleeding usually becomes less regular as she approaches menopause. Can ligation make a woman lose or gain weight? The answer is no. Sterilization does not cause any change in weight, appetite, or appearance. However, older women are more likely to choose sterilization as a method of family planning than younger women, and most women gain weight as they age. Can I have a pregnancy outside the womb or ectopic pregnancy after ligation? The answer is no. After ligation, women face less risk of having an ectopic pregnancy than women who have not had ligation. We are now answering questions regarding vasectomy. Is vasectomy a very painful procedure that causes sperm retention leading to complications? The answer is no. Male sterilization is a safe and simple procedure. A small incision is only made at the site of scrotum. Discomfort in the scrotum area and swelling are minor and can be treated with cold compress and non-aspirin pain relievers. It usually lasts for 2 to 3 days and then completely disappears. Sperm that are not ejaculate get absorbed by the body, so there is no sickness that results from that. Is vasectomy the same as castration? The answer is no. Vasectomy is a simple procedure in which each vas deferens is either blocked or cut so that sperm cannot enter semen. It is not the same as castration, and the procedure of vasectomy is not to amputate or mutilate the male genitals. Castration is only for animals. Will vasectomy cause me to become less macho or make me effeminate? The answer is no. Vasectomy does not make a man less macho or make him effeminate. It does not interfere with any normal body function or cause other type of changes. It does not involve removal of the testes, thus a man will continue to produce male hormones. Will the sperm accumulate in the scrotum and cause it to burst or cause other problems? The answer is no. The body absorbs sperm that are not ejaculated. Sperm cannot accumulate in the scrotum nor cause the scrotum to burst or harm the body in any way. Does vasectomy cause cancer? The answer is no. Clinical studies indicate that vasectomy does not cause prostate cancer or cancer of the testicle or any other long-term problems. Unused sperm do not get rotten and cause cancer because it is absorbed by the body. Can vasectomy cause heart problems, harm the immune system, or cause impotence? The answer is no. There is no evidence that vasectomy increased the risk of cardiovascular disease or immune system problems. It does not affect sexual drive, nor does it affect a man's ability to get an erection, have sex, or ejaculation. It will not impair sexual function and sexual pleasure. Can I still perform physical labor after undergoing vasectomy? The answer is yes. Vasectomy has no effect on man's overall health and physical ability. He will look the same and feel the same as before. After a recovery period of 2 to 5 days, he can return to his normal physical activities. The operation will not cause the man to lose strength, so he can work as hard as before. It will not cause weight gain, hair loss, or impair mental function. Can it be reversed and allow men to become fertile again? The answer is no. Vasectomy is intended to be permanent. People who may want more children should choose a different family planning method. We are now answering questions regarding NFP or natural family planning. Are NFP methods effective in preventing pregnancy? The answer is yes. NFP methods can be effective if practiced correctly and consistently. In a study of lactation amenorrhea method in the Philippines, only 2% of women who use the method correctly and consistently become pregnant in a year. For cervical mucus method or bleeding ovulation method, only 3% of women who use the method correctly and consistently become pregnant in 1 year. Is modern NFP only for highly educated couples? The answer is no. Studies show that couples worldwide, whatever their economic or educational status, can use NFP methods successfully if they are properly trained and highly motivated. Is NFP too complicated to be used by most couples? The answer is no. Anyone who is taught by a certified or trained health service provider and motivated to use NFP can do so. The methods are simple that they have been successfully adapted to suit the needs of cultures all around the world. Is it true that only women with regular menstrual cycle can use modern natural family planning? The answer is no. Studies show that most women, regardless of cycle's regularity, can use up modern NFP methods as long as they can correctly identify their fertile periods. Can most men accept abstinence during a woman's fertile period? The answer is yes. Study shows that for most couples who choose to practice modern NFP, the men reported that they were not particularly bothered by the required abstinence during their partner's fertile period. Is withdrawal a modern NFP method? The answer is no. Withdrawal or coitus interruptus is not a modern natural family planning method. Withdrawal is not that effective and may make sexual union less satisfactory for the couple. Is rhythm or calendar method a modern NFP method? The answer is no. It is considered a traditional method of family planning and therefore not being recommended for couples to use. The rhythm method involves counting the days before and after menstruation to predict a woman's fertile period. Is it true that SDM works well for all women? Approximately 50 to 60% of all women have 26 and 32 days long cycle. Women who have cycles shorter than 26 days or longer than 32 days are not good candidates for SDM. Also, women who will not be able to avoid sex on the days they might get pregnant are not likely to be successful using this method. Can women predict ovulation through basal body temperature? You cannot determine from BBT ahead of time whether you are about to ovulate or not. It will only tell you when you have ovulated. There is sometimes a drop in temperature on the day of ovulation, but whether it was really ovulation or not can only be determined after the temperature has gone up or stayed up, typically for several days. This is the reason why in BBT method, couples avoid sexual activity from first day of menstruation up to the time that the body temperatures rise for about zero point 0.2 degrees Celsius, or that's ovulation period, and the rise in temperature stay for a few days. Couples can resume sexual activity starting on the fourth day of the rise in temperature up to the last day of menstrual cycle. Will exclusive breastfeeding protect against unwanted pregnancy as long as women continue breastfeeding their child? Research has proven that LAM will only work if women's menstrual bleeding has not returned since her baby was born, and the baby is exclusively breastfed, and the baby is less than 6 months old. The effectiveness of LAM depends on exclusive breastfeeding. This means as often as the baby is hungry or on demand, day and night with no long intervals between feeds. Even if a woman expresses breast milk, if she is separated from her baby by more than a few hours, she cannot expect a high level of contraceptive protection. The infant suckling triggers a signal to the mother's brain that interferes with the production of the hormones needed for ovulation. Ovulation is necessary for pregnancy to occur. This is the end of my presentation. Thank you for listening, and be reminded that the best thing to do is encourage couples to talk about family planning. Happy Women's Month.